12 things no one ever told you about menopause symptoms. Welcome to Your Health. Today, we're uncovering 12 surprising symptoms of menopause that most people have never heard about. Menopause is a natural stage in every woman's life, but its effects can go far beyond hot flashes and irregular periods. From skin changes to sleep disturbances, emotional shifts, and even unexpected issues like dry eyes or hair loss, the body reacts in ways that are often misunderstood or overlooked. In this video, you'll learn about the lesser-known signs of menopause, why they happen, and how to manage them with confidence and care. So if you're going through this transition or supporting someone who is, stay with us until the end. What you discover today might change the way you see this powerful phase of life. Let's get started. Menopause symptom number 1. Skin problems. During menopause, the decrease in estrogen levels can lead to a reduction in collagen, an essential protein that helps moisturize the skin and prevent wrinkles. This deficiency may cause dry skin and uncomfortable sensations such as tingling or the feeling of insects crawling. Fortunately, these discomforts can be relieved with moisturizers, available in various forms. If you prefer natural solutions, consider using aloe vera gel as a daily moisturizer. Grapeseed oil can also be effective. In addition, staying well hydrated by drinking enough water is crucial. Another explanation for dry skin is related to estrogen, which influences the nervous system. Hormonal fluctuations can directly affect the nerves, causing tingling, burning sensations, and increased sensitivity. Fortunately, these sensations tend to subside as estrogen levels stabilize. Menopause symptom number 2, dry eyes. Menopause affects much more than just hormones and the reproductive system. It can also have a direct impact on eye health. Many women going through menopause or already in the postmenopausal stage report experiencing dry eyes, which may come with itching, a burning sensation, or an ongoing feeling of discomfort. While it might seem unrelated at first, this symptom is actually quite common and is primarily linked to the natural drop in estrogen levels that occurs during this time. Estrogen plays an important role in maintaining the function of the meibomian glands, which are located in the eyelids. These glands are responsible for producing the lipid layer of the tear film, the layer that prevents tears from evaporating too quickly. When estrogen levels fall, these glands may become less effective, leading to poor tear quality and dryness. As a result, the eyes can become irritated, red, or increasingly sensitive to light. In fact, about 50% of women during or after menopause report experiencing some degree of dry eye symptoms. To manage this issue, it is advisable to reduce screen time and take frequent breaks, especially during long periods of computer use. Artificial tears or moisturizing eye drops can help relieve dryness. Wearing glasses instead of contact lenses may also reduce irritation. Staying well hydrated and including omega-3 rich foods in your diet can further support long-term eye comfort and health. Menopause symptom number 3, body odor and bad breath. Experiencing bad breath immediately after brushing your teeth can feel uncomfortable and even embarrassing, but there is no reason to feel ashamed. Surprisingly, this issue can be linked to menopause, and it is more common than most people realize. In addition to bad breath, many women also notice a stronger vaginal odor, or a sense of discomfort in the intimate area during this time. This happens because during menopause, the vaginal environment, which is normally acidic, can become more alkaline due to a decline in estrogen levels. This shift in vaginal pH can lead to irritation, dryness, or even painful sexual intercourse. To manage this dryness, using vaginal lubricants is strongly recommended. As women age, the vaginal walls naturally become thinner, which further increases the risk of inflammation and infections. To prevent these issues, it is important to avoid vaginal douching. Douching removes beneficial bacteria and disturbs the natural microbial balance. Instead, opt for gentle, fragrance-free soaps made specifically for the external vaginal area. Avoid using generic or heavily perfumed feminine hygiene products, as they can worsen symptoms and increase the chance of infections. Additionally, check that any irritation is not being caused by a fungal infection. Consider adding probiotic-rich foods or supplements to your routine to help support a healthy and balanced vaginal ecosystem during this transition. Menopause symptom number 4, urinary problems. During menopause, many women begin to notice unexpected changes in their urinary system. This is largely due to the natural decline in estrogen, a hormone that helps maintain the strength and elasticity of the tissues lining the bladder and urethra. As estrogen levels fall, these tissues can become thinner, weaker, and more prone to irritation, making urinary symptoms more frequent and sometimes more difficult to manage. Some of the most common issues include urinary incontinence, which is the involuntary leakage of urine, an increased need to urinate, including waking up multiple times at night to use the bathroom, and a higher risk of urinary tract infections. These symptoms are not only uncomfortable, but they can also impact a woman's confidence, sleep quality, and overall quality of life. Fortunately, there are ways to manage and relieve these symptoms. Consulting a healthcare professional is the first and most important step. A proper diagnosis can lead to a personalized treatment plan, which may include local hormone therapy to restore vaginal and urinary tissue health, specific medications to reduce urgency or leakage, and pelvic floor exercises, such as Kegel movements, to strengthen the muscles that support bladder function. Additionally, some simple daily habits can make a big difference. Avoid drinking large amounts of fluids before bedtime, empty your bladder regularly, maintain good intimate hygiene, and limit consumption of bladder irritants like caffeine and alcohol. With timely action, awareness, and consistent care, it is entirely possible to regain control and manage urinary challenges associated with menopause in a healthy and empowering way. Menopause symptom number 5, joint and muscle pain. During menopause, many women report experiencing joint and muscle pain that may seem to appear without an obvious cause. These discomforts are often related to the natural decline in hormones such as estrogen and progesterone, which play a vital role in maintaining the health of bones, joints, and connective tissues. As hormone levels decrease, bone density tends to decline as well, making the body more vulnerable to conditions like osteoarthritis and other inflammatory or degenerative joint diseases. In addition to bone changes, the drop in hormone levels can also affect the surrounding tissues. Ligaments, tendons, and muscles may become stiffer, less flexible, or more prone to soreness and fatigue. These changes can make everyday movements feel more difficult or even painful. Fortunately, there are ways to manage and reduce these symptoms. Engaging in regular physical activity, particularly exercises that promote joint flexibility and strength, can make a significant difference. Stretching, low-impact workouts such as swimming or walking, and practices like yoga or Pilates can be highly beneficial. Seeking professional therapies such as physiotherapy or acupuncture may also help relieve chronic pain and improve mobility. In more severe cases, a healthcare provider may recommend medications to help reduce inflammation, ease discomfort, and slow the progression of arthritis. With consistent care and movement, it is possible to maintain joint health and physical comfort during menopause. Menopause. Symptom number 6, mental confusion. Have you recently walked into a room and forgotten why you went there? Or maybe you've spent time searching for something you know you put away carefully, only to find it in an unexpected place? These moments of forgetfulness can be unsettling, but they are actually very common during menopause. Hormonal changes, especially the decrease in estrogen, can have a noticeable impact on brain function. Estrogen plays a role in supporting cognitive abilities such as memory, attention, and focus. When its levels decline, some women experience what is often referred to as brain fog. Brain fog is not a medical condition in itself, but rather a term used to describe a state of mental cloudiness, forgetfulness, or slowed thinking. For many, it can become a source of frustration or even anxiety, particularly when it begins to interfere with everyday tasks or routines. Studies show that nearly 60% of women going through menopause report cognitive challenges. The good news is that these symptoms are usually temporary. With time, and by applying certain habits and strategies, mental clarity can be regained. To help manage this phase, keeping a structured daily routine can be very effective. Try using calendars, lists, or sticky notes as reminders. Engaging your mind with activities such as crossword puzzles, brain games, or memory exercises can also stimulate cognition. Meditation, mindfulness, and breathing techniques are helpful tools to lower stress, which tends to make brain fog worse. Most importantly, be kind to yourself. This is a normal part of the transition. With patience and healthy routines, you can move through this period more calmly and regain your mental sharpness. Menopause symptom number 7, sleep disorders. Menopause is a time of profound hormonal change, and one of the most common and disruptive symptoms experienced by women during this phase is sleep disturbance. Many begin to face restless nights, frequent awakenings, trouble falling asleep, or waking up feeling unrefreshed, even after several hours of rest. These difficulties are often connected to a decrease in estrogen levels, a hormone that plays an essential role in regulating the body's circadian rhythm, the internal clock that governs our sleep and wake cycles. In addition to hormonal changes, other menopause-related symptoms can worsen sleep problems. Night sweats, caused by hot flashes, often wake women up drenched in sweat and discomfort. These episodes not only disrupt sleep but can also make it harder to fall back asleep afterward. On top of that, psychological factors such as increased stress, anxiety, or depression, which may become more intense during this stage, can further interfere with the ability to rest well. The effects of chronic sleep deprivation extend far beyond feeling tired. Poor sleep can affect memory, reduce concentration, and increase the risk of developing serious health issues, such as cardiovascular disease or metabolic disorders. That is why it is so important not to dismiss these sleep challenges as simply part of aging. To improve sleep quality during menopause, adopting a consistent nighttime routine is essential. Limiting screen use before bed, practicing relaxation methods like deep breathing or meditation, and avoiding stimulants such as caffeine in the evening can all make a meaningful difference. A healthy lifestyle that includes balanced nutrition and regular physical activity will also support better sleep and greater well-being overall. Menopause, symptom number 8, mood changes. Mood swings are one of the most frequent and often most emotionally unsettling symptoms experienced during menopause. This transitional phase is marked by major hormonal shifts, especially involving estrogen and progesterone. These hormones do much more than regulate the reproductive system. They also interact directly with brain chemicals such as serotonin and dopamine, which influence our emotions, mental stability, and overall sense of well-being. Because of these changes, it is not uncommon for women who were once emotionally balanced to suddenly experience waves of irritability, anxiety, or sadness, without an obvious cause. Some may go through intense emotional ups and downs, or feel on edge more often than usual. Others may face persistent worry, a sense of overwhelm, or even depressive episodes that can resemble clinical depression. These symptoms may be further intensified by other common menopause-related challenges, such as sleep disruption, hot flashes, body discomfort, changes in family dynamics, or stress at work or in relationships. It is crucial to understand that these emotional responses are normal and do not reflect personal weakness. Seeking help, whether through counseling, medical guidance, or simply talking to someone you trust, is not only valid, but often very helpful. Mental and emotional health deserve the same attention as physical health. Alongside professional support, daily habits can also help restore emotional balance. Practices like mindfulness, deep breathing, yoga, or taking regular walks in nature have been shown to reduce stress and stabilize mood. Maintaining a balanced diet, staying active, and nurturing strong social connections can also play a powerful role in supporting mental well-being throughout this stage of life. Menopause symptom number 9, sexual problems. Menopause can profoundly affect a woman's sex life due to the hormonal changes it causes. Beyond vaginal dryness, already widely recognized, other issues may arise, such as reduced sexual desire, difficulty reaching orgasm, or even pain during intercourse. These changes can be upsetting both physically and emotionally, affecting romantic relationships and self-esteem. The hormones estrogen and testosterone, though present in smaller amounts in women, play a key role in the sexual response. They influence lubrication, blood flow to the genital area, and tissue sensitivity. Their decline can therefore lead to a drop in libido, reduced pleasure sensations, and significant discomfort during sex. What was once spontaneous can become a source of anxiety or frustration. In this context, communication with your partner becomes essential. Talking openly about feelings, fears, and needs helps maintain closeness and explore new forms of intimacy, softer and more adapted to this phase. It may also be helpful to consult a healthcare professional who can suggest personalized solutions. Appropriate lubricants, local or general hormone therapy, couples therapy, or sex therapy guidance. It is important to remember that every woman experiences this stage differently. There is no one-size-fits-all answer, but there are many ways to redefine a fulfilling sex life despite the changes. Menopause. Symptom number 10, hot flashes and night sweats. One of the most well-known, yet often underestimated, symptoms of menopause is the sudden sensation of intense heat known as a hot flash. These episodes typically begin in the face, neck, or chest, and can spread throughout the body, often accompanied by flushing, sweating, and a rapid heartbeat. When they occur during sleep, they are called night sweats, which may cause women to wake up drenched in perspiration, often disrupting sleep quality. These symptoms are caused by fluctuating estrogen levels that affect the hypothalamus, the part of the brain that regulates body temperature. The body may mistakenly believe it is overheating, triggering a cooling response such as sweating and dilation of blood vessels. To manage hot flashes and night sweats, try wearing breathable fabrics, layering clothes for easy removal, and keeping your bedroom cool at night. Reducing spicy foods, caffeine, and alcohol can also help. Mind-body techniques like paced breathing, yoga, or meditation have shown positive effects, and in more severe cases, hormone therapy may be considered under medical supervision. Menopause symptom number 11, dry skin and loss of elasticity. During menopause, many women notice changes in their skin. It becomes thinner, drier, less supple, and loses its natural glow. These changes are mainly due to the decline in estrogen levels, which leads to reduced production of collagen and elastin, two essential proteins that help maintain skin firmness, elasticity, and hydration. With the hormonal drop, the skin retains water less effectively, which increases dehydration. In addition, free radicals, responsible for oxidative stress, can speed up the appearance of wrinkles and worsen skin sagging. This aging process may be further aggravated by external factors such as excessive sun exposure, pollution, or an unbalanced diet. To combat these effects, it is recommended to adopt a specific skincare routine. Daily use of moisturizing creams, rich in nourishing agents, helps restore the skin's protective barrier. Applying sunscreen is also essential, even in winter, to prevent damage caused by ultraviolet rays. At the same time, a diet rich in antioxidants, found especially in red fruits, green vegetables, nuts, and fatty fish high in omega-3, supports cell regeneration and fights inflammation. With the right care and a healthy lifestyle, it is entirely possible to maintain healthy, radiant, and resilient skin throughout menopause. Menopause. Symptom number 12. Hair loss and thinning. Hair is often seen as a symbol of vitality and femininity. That is why any changes to its appearance can feel especially upsetting. During menopause, many women notice a visible transformation in their hair, including increased hair loss and a noticeable thinning of the strands. This can affect not just physical appearance but also confidence and emotional well-being. The primary reason for this change lies in the drop of key hormones, particularly estrogen and progesterone. These hormones are essential for supporting the growth, strength, and life cycle of hair. As their levels decline, the hair follicles receive less stimulation, which results in slower hair growth, weaker strands, and increased shedding. You may find that your hair breaks more easily, grows at a slower rate, or that certain areas of your scalp begin to appear more sparse or exposed. Additionally, when estrogen levels fall, the body may experience a relative increase in androgens, often referred to as male hormones. In some women, this hormonal shift can lead to a condition known as androgenetic alopecia, which causes thinning at the crown or receding hair density over time. The hair may also appear duller, finer, and more brittle due to these imbalances. Recognizing these signs early is important. If you notice unusual hair loss, consult a healthcare professional. A medical evaluation can help rule out other possible causes such as thyroid disorders or nutritional deficiencies. Once the cause is confirmed as menopause-related, your provider may recommend treatments tailored to your needs. These could include nutritional supplements, topical lotions, or even hormone therapy in certain cases. Maintaining a healthy hair care routine is also essential. Use gentle, nourishing shampoos and conditioners designed to strengthen fragile hair. Look for products enriched with ingredients like biotin, keratin, castor oil, or argan oil, all of which help fortify the hair shaft and support scalp health. Minimize heat styling and avoid harsh chemicals that can worsen breakage. Incorporating natural remedies into your routine can provide added support. Scalp massages using oils like coconut or rosemary can help stimulate blood flow to the hair follicles. Aloe vera gel, and even onion juice, although strong in smell, are often cited for their potential to promote hair regrowth and reduce inflammation. Diet plays a critical role as well. Focus on eating foods rich in iron, iodine, zinc, and B vitamins, all crucial nutrients for maintaining strong, healthy hair. Consider including leafy greens, legumes, eggs, nuts, seeds, and fish in your meals. Above all, remember, this stage of life does not mean you are losing your strength or beauty. You are not aging too quickly, you are evolving. Menopause is a transition, not a decline. Be gentle with yourself. You are still vibrant, strong, and capable of adapting. You deserve compassion, care, and confidence during this beautiful phase of transformation. If you found this video helpful, please leave a like and share it so that more women can access this information. Stay connected with your health and check out one of the recommended videos on your screen right now.